And
All right. Well, I'll try the next question.
okay.
um, Now, Crystal, in your recent article that you wrote, you talked about how some parents might be afraid to bring up difficult issues with children because it might, quote unquote, feed into their crying. How important is it for parents to bring difficult issues up with their young children, even when they know the issue will be upsetting?
I think it's really important. Um, it's hard. And I think that's why parents avoid it because they're dealing with their own difficult feelings about the situation. They know it could be difficult for the child. So, culturally, we have this way of really not acknowledging negative feelings at all. I always think of the example of, hi, how are you? That's sort of a salutation in our culture, and yet the correct response is good or fine. Even if you're having the worst day in the world, somebody comes up and says, hi, how are you? We go, oh, I'm fine, I'm great. And we never really acknowledge what's going on for us because it's uncomfortable on the other side. So we avoid those uncomfortable conversations. And for our kids, we don't want to see our kids cry. It's hard for us when we see that. So we want to avoid it. And we do the whole, it's okay, don't worry. And we do all of this. And meanwhile, it's not okay for the child. And the child can't really learn to deal with those difficult emotions if we don't allow them to experience them. So, by addressing them with the child and acknowledging them, really helps the child move through them and learn to deal with it. Because later on, they're going to have to deal with negative emotions. So, it's really the beginnings of helping your child cope with difficult situations. And by you providing a model and by you talking about it with them and allowing them to experience life's lows while sort of supporting them while they move through that and coming out on the other side helps a child to learn that, just because I have this negative feeling doesn't mean the world is over. It's awful, but I can feel it. And I can also know that it's going to be okay. And I also know that I have the most important people in my life who are willing to share that experience with me, who aren't going to run from my negative thoughts and feelings, and who are willing to stick it out with me when times are tough. So it can actually be a very powerful relationship and attachment strengthening for the parent and child relationship when things are difficult.
Now, how does it change when the parent is having a hard time dealing with a traumatic situation? Say, I keep
Hmm.
going back to
Hmm.
divorce because it's what I see, but for the parent that is very upset about their divorce and at the same time have a young child that they need to keep informed about the situation, how do they do it when it's so upsetting to them to begin with?
And that's sort of the toughest part. If you're dealing with a situation with your child that is occurring outside of the home, say bullying, for example, it breaks your heart, but it's not directly affecting you. So oftentimes you can be there for your child in a really empathic way, and despite the fact that it's heartbreaking for you, you can sort of be strong in that. However, when you've also experienced the same sort of crisis or trauma or difficulty, it can be really hard to be with your child and provide the support that they may need because you're really in need of your own support.
Yeah.
So, in times like that, when parents feel as though, oh my gosh, I'm just so distraught with what's going on for me that I don't think I can really be there for my child without completely falling apart, then that just may be a time when you ask for a little support from a professional, seeking either a therapist or consulting with your pediatrician if you're concerned about some of the regression to make sure that it's not something physical going on, but then seeking a trained professional to help you support your child. When these things happen, it's normal to be distressed. So the
Yeah.
parent's going to experience distress and the child is going to experience some distress. That's normal. But if it becomes too overwhelming where you feel like you're not being helpful, it's just a time to say, you know what, I can't do this on my own. And I really need somebody to support me while I address these concerns with my child. And that can be done, a few different ways. It can be a parent child session of therapy where we're working on that relationship, or it can also be just individual therapy for the child where they're working on their own process of sorting through what's going on for them.
Now, I see all the toys behind you on the shelves, and I know you're a registered play therapist. How can, what is the play therapy, and how do you use it to help children through tough times?
Play therapy is just really the most effective modality in working with very young children. You know, sometimes I get calls and their parents are saying, "My child's so talkative, we don't need toys." And even for the most talkative children, the toys become their words. Because children don't have a ton of life experience, they can't always conceptualize everything in their vocabulary. So they take the toys and they act it out. It helps children make sense of their world. And in crisis situations, you will see that children all of a sudden will want more play. And parents say, "Oh my gosh, it's like they're indifferent to what's going on." Well, no, they're actually using it as a coping skill to try and sort through what's going on for them through their play. I tell parents, watch their play, see what they're playing out. They're trying to make sense of their situation because they don't have the words for it. So in crisis situations, you'll often see children play the same type of scenes over and over and over and over and over again, and there'll be these just noticeable differences of some resolution in the play, and it often mirrors their real life, where they start to see slowly but surely some resolution to the crisis, and that's how they make sense of it, in their minds, is through the play. So they use play therapy in the same way that adults use talk therapy, where they're addressing what's going on for them. They're finding new coping skills in a really safe environment to where they can effectively manage their feelings and their behavior. So we move through all of those things, and you start to see the emotional dysregulation, dysregulation starts to dissipate because the child's made sense of what's going on and they're able to move forward.
Well, I think we're getting close to the end of the time that we had allotted off for this, but if you could, I mean, tell me where people should look if they want to seek you out and get your help on an issue with their children. You're one of the few people I know, well, the only person I know that calls themselves a registered play therapist and really specializes in dealing with very, very young children. So where can people reach out to you and find you?
I have a private practice in North Palm Beach. I also have an office up in down in Lake Worth that I am out once a week. The best way to reach me is probably by phone. The telephone number is 561-352-6192, and I'm happy to offer complimentary consultations for parents to see if play therapy may be an appropriate fit for their child, depending upon what's going on for them. I also have a website that they can check out for more information about me and play therapy in general. It's healthymindedkids.com, and that's also the name of my private practice.
Well, thank you again for all of your time and for making the time to do this.
Absolutely. Thanks so much for having me.
All right, I think that